I believe we are coming now to the end of the first phase of this conflict, and in spite of all the suffering, we have so nearly succeeded. We did not allow our NHS to collapse, and on the contrary, we have so far collectively shielded our NHS so that our incredible doctors and nurses and healthcare staff have been able to shield all of us from an outbreak that would have been far worse.
Today, I want to address what we're doing to make sure that we have enough PPE, protective equipment, and to make sure that it gets to the right people. The goal I've set is that everyone working in a critical role must get the PPE that they need. NHS and care staff protect us every day. While we're safe at home, they go off to work to care for us. We owe it to them to get them the kit they need to protect themselves.
For weeks, the government has been dealing with criticism about stocks of personal protective equipment, or PPE. It says it's delivered 1 billion items. But we've obtained documents from inside the supply chain that show the reality of what's been delivered in the past couple of months. They show that the government is counting items you might not think of as PPE, such as cleaning equipment, waste bags, detergent and paper towels. More than half the items are surgical gloves, and in most cases, each individual glove is counted rather than pairs. The second biggest item is plastic aprons that offer limited protection. The documents show how much PPE has been sent to each hospital trust in England. And we've discovered it wasn't just gowns left off the shopping list. The government also failed to buy other essential items that would be needed in a pandemic.
The government didn't buy any visors at all. There were no swabs either, which makes testing for the virus more difficult. And the government didn't buy a single body bag, despite the fact they were supposed to be preparing for a pandemic.
You haven't had enough PPE, you haven't got enough tests, you didn't have enough ventilators. What was it you were prepared for?
Piers, I think you're slightly misjudging the public mood, because I've come on
I don't give a damn about the public mood, I care about you answering my questions.
And I take you back to January, when you made a statement in the House of Commons that Britain was, quotes, well prepared and well equipped to tackle any contagion, and we had a world-leading test for COVID-19. Had you been misled, yes, or were you lying?
No, that was totally, that is totally accurate and was.
We were well prepared and well equipped, were we, Health Secretary?
Yes. And our goal was to reach 10,000 tests a day by the end of March, and we met that goal. But we clearly need to do more, and we clearly need to increase the number. In terms of the overall preparations, nobody can be fully prepared. No country can be fully prepared for a new disease. But in terms of the amount of PPE, protective equipment that we've got in store, it's hard distributing that to every single person on the front line, and we've got a huge effort underway on that. But in terms of having the stores, and in terms of having that test, the world-leading test was, we developed one of the first ones here. The challenge is the massive expansion that's needed of testing.
You stand by those words, we were well prepared and well equipped?
Yes, I do. But
why the
I'm
scramble
also
for
totally...
Sorry, so why the scramble now for ventilators then? And masks?
Because you've got to respond to the individual disease that you face. You know, this is a new disease, so you can be prepared in the generality.
Panorama has discovered that just last year, the government's own advisors warned that gowns were needed in the stockpile, but still none were bought. At the start of February, the European Centre of Disease Control issued a warning. They advised us what we needed to buy and how much. The document says we'll need respirator masks, eye protection, gowns and gloves. For the most serious cases, around 20 sets of PPE per patient per day.
I feel really angry at the government that they had all this time. We had the luxury of time. We saw it coming. We should have used that time to prepare. And they keep saying this unprecedented thing that this is completely unprecedented. It is unprecedented, but it wasn't unexpected.
Across the UK, images of doctors and nurses in homemade kit have been posted online. Aprons made from bin bags, plastic bags on heads, swimming goggles and other home-supplied eye protection. In January, the government designated COVID-19 as what's called a high-consequence infectious disease. The Health and Safety Executive had already investigated what PPE was needed when tackling a high-consequence infectious disease. It concluded all staff should wear a respirator face mask, full face visor and a gown. And the government has a legal obligation to make sure NHS staff have the right kit.
But 6 weeks ago, the government downgraded COVID-19, the most consequential disease of the last 100 years, was taken off the list of the highly consequential infectious diseases.
Here are the recommended PPE components: apron, alcohol hand rub, gloves.
At the same time the virus was downgraded, the government weakened the guidelines on PPE.
Step 1. Put on your disposable apron.
Health workers were now told they were safe to wear the less protective aprons and surgical masks in all but the most dangerous situations.
Carefully make this type of surgical face mask is secured around the ears with elastic.
This must have been done because they realised that they weren't going to have enough equipment and they needed somehow to have a story that stacked up with actually being caught out on supplies.
Should COVID-19 be on that list?
COVID-19 is the biggest infectious disease to hit this country in the last 100 years. Why on earth shouldn't it be in the most serious category of classification?
Our health service is at the heart of the nation's fight against the disease.
This public demonstration of support means such a lot to those who work in the NHS. But some of them worry that this outpouring of emotion helps the government gloss over the shortages that are on some of the wards. As one intensive care nurse said to us, calling us heroes just makes it okay when we die.
Many frontline staff are angry with the government. Some say there's a gap between what they hear is coming and what they see on the wards. So many NHS staff have already died while trying to protect us from the disease. COVID-19 will be with us for months. How many lives will be lost because of the scandalous shortage of PPE?
In spite of all the suffering, we have so nearly succeeded.